at AstraZeneca, we have a bold ambition to cure cancer, and not just locally, but worldwide. And through following science and discoveries, we're finding that we can find new treatments to help patients, and partnering with the Partnership to Reduce Cancer in Rhode Island is a perfect way to collaborate, to advocate for patients, to find resources to help support patients, caregivers, as well as practitioners to really help cure cancer. And why not do that together, right? Yeah, so it's so important to come together and to work collaboratively to help patients, to help physicians, to help practitioners, to help the entire team of folks to really, not only advocate, but to support and provide ways to cure cancer locally. And I think coming together like this is a perfect example of how the more people involved can make a bigger difference. Yeah, I mean, I think it's fantastic. I think, there was a lot of energy and a lot of really great conversations and discussions around how we can move the needle a little bit further down the road and to really help each other out and just learning from each other. There was just a lot of really good collaboration.
Well, I'm so thankful that the partnership invited me here to be a keynote. I was first here 8 years ago as Miss Rhode Island, a newly crowned 19-year-old with big aspirations to go into medicine. And today I got to come back and discuss that I achieved some of those goals as a registered nurse and certified oncology nurse, but as well as a huge advocate for pediatric cancer. I've had the opportunity to work with pediatric cancer advocacy programs through Hasbro Children's Hospital, but specifically the Izzy Foundation. The Izzy Foundation, I'm an executive board member, and it is near and dear to my heart. They truly help children and families at Hasbro and throughout Southeast Massachusetts. They give 5 meals a week throughout the children and the families at Hasbro, as well as scholarships to cancer survivors and their siblings. So I loved that I got to share their mission as well as my journey of being a cancer survivor and a big sister to Michael, who passed away from cancer, and honor his memory, as well as educate everyone on the importance that pediatric cancer only gets 4% of funding nationally. The children are our future, so we have to advocate if we want to have a solid future. Every 3 minutes, a child is diagnosed with cancer, and by the end of my presentation that I gave, 12 kids were diagnosed in that time. And that is something that we have to start advocating more, because without the support, we're not going to be able to combat childhood cancer. And I'm very thankful the partnership has made this their priority in the coming year as a new advocacy way, especially to introduce palliative care. So I am a cancer survivor of neuroblastoma, and I'm a big sister to Michael that passed away from medulloblastoma. So from a young age, I was at the hospital constantly, and now I'm there constantly as an RN working in the RICU at Rhode Island Hospital. But it gave me an appreciation of what the doctors and nurses do. Growing up, they were my advocates. My parents were my biggest ones. They helped get me the right treatment, the right care plans, and had my back. But they also relied on information through organizations like the partnership on who to go to, new clinical trials, research documents, what are different avenues they can do to support their children. As a nurse, I can now promote the partnership, promote different organizations and say, hey, you have this going on. I have a resource that you can turn to. So it gave me a different view. I have a whole different set of empathy, especially that I got to start my career in bone marrow transplant and being a surgical oncology nurse, originally at Roger Williams Medical Center, and then eventually transitioning into critical care. But critical care and oncology both still have the same heart. They're people. There's people behind the diagnosis, and we have to care for those people. Without advocates, the families don't have the support. The parents, when they have a child diagnosed with cancer, their focus is that child and surviving every single day. So we need these patient care advocates. We need the interdisciplinary teams and organizations like the partnership, like the Izzy Foundation, to give that extra support when the parents don't even know they need it. To say, your child's undergoing treatment today, well, here's lunch. You don't have to leave the room. Your child's undergoing a new symptom, well, let's get palliative care involved. Let's call social work. Let's call OT, PT, get those people involved. So by advocating, and that can come from being a nurse, from even being a friend and learning something, from being a physician and having a new avenue, hearing the partnership has these resources, or the Izzy Foundation has this new fun play date on Friday nights, and the kid just wants to be a kid. And the biggest thing with pediatric cancer is kids want to be kids, and we have to support the development of the child and let them live even though they have a cancer diagnosis. I would not be a nurse if I didn't have hope every single day. Every day is a new day. I meet people on their best days or their worst days, and a lot of times it's their worst days, especially when they are in the RICU, or when I was back as an oncology nurse when they were a new diagnosis. But I also get to be with them when they survive cancer, when they get to celebrate Christmas in their hospital room, when they get to make it to their daughter's wedding. That's the hope that drives us every single day. And it's also moments like days like today when we all get to come together, educate and learn. Because without education and furthering advocacy and furthering our knowledge, whether it be nurses, physicians, healthcare providers, or even our friends and family, we won't be able to continue. So that gives me hope, knowing we have organizations such as the partnership that's going to help with that.
So first of all, we at the Gloria Gemma Breast Cancer Resource Foundation are proud to be a sponsor of the Cancer Summit. And we are here today, and the importance for us is that the partnership, both through the Cancer Summit and in its work all year, gives a space to those multiple Rhode Island organizations that serve cancer patients, survivors, and their families. Through the conversation and collaboration, we are able to work together, respecting and realizing how many multiple programs are out there through these organizations, and that can only result in better care and better outcomes for those families who are living with cancer. And it covers all medical aspects, psychosocial, emotional, and even grief. And as a foundation, we benefit from it because it widens the platform to whom we can bring our many free holistic programs for mind, body, and spirits in those populations, and with the goal of always moving survivors to become thrivers. The opportunity through the partnership and the Cancer Summit also helps us to broaden our platform for bringing cancer education into the community, and specifically to those populations that are underserved. Okay. Yes, definitely. The goal is the same for all of our organizations. And so the partnership allows us, rather than to compete, to work together because there's power in numbers. And it also helps us to not recreate the same programs that are already existing there, because we communicate through the partnership and we know what's there, and we can help each other strengthen the programs that we offer. What's important for us is that we learn what others are doing, but we also are able to strengthen each other in what we offer, with the goal, as I said earlier, always being towards the patient, the survivor, and the families, and supporting them, because it's very difficult to live through cancer. I have lost 3 family members to it. And today especially, I've lost 2 cousins. When I was very young, I learned what cancer and death was about at the age of 9, when I lost my first cousin to it. So it's very important to be part of the partnership and to be able to help it move its work forward, and be a partner with them in that. Yes. Well, it's wonderful to be together with people, hands down. I do community outreach and education for the foundation. We have a pink RV we call the Hope Bus, and that's where I spend most of my days. So it's been really hard for me to be locked in an office. And so to be able to be out and be able to talk to people face to face instead of through a computer makes all the difference. You know, there's a whole different energy that happens when you're talking to someone in person versus talking to someone through a computer screen. So we look towards the partnership for the many programs and educational opportunities that they connect us with, because with being able to access conferences that maybe we don't know about, or information that's updated rather, and recent concerning cancer treatments and cancer care, it helps us improve our programs. And in that way, as we all work together, basing everything on the same information and equal information, it can only improve the situation in Rhode Island when it comes to cancer.
Children's Wishes provides wishes to kids 2.5 to 18 years old who live in Rhode Island. What we also pride ourselves on is keeping in touch with our families long after the wish, with family programming, from golf lessons to a wellness program to our Words for Wishes. One thing we also find to be very important is our partnerships. We leave our egos at the door when we come into work, and we're constantly looking for organizations to work with to serve our families. One thing that we do find is, for instance, with many of the kids who are treated at Hasbro, they have wonderful in-house resources, but once they leave the hospital and are treating with their primary care and perhaps have no contact with the wonderful people at the hospital, there's a sense of isolation. So we try and maintain our contact with the families and facilitate partnerships where we can. We don't want to reinvent the wheel, and we love working with all of the organizations, many of which who are here today. So to be able to come and spend the morning with them, to be able to hear the panelists and about the future of pediatric cancer and perhaps some positive results down the line was wonderful. The palliative care panel really hit home because of Dr. Anderson and Laura, who is a social worker for one of our kids. So we're working on something as we speak, so it was nice to at least have them know that there are resources out in the community who are able to help these children. Well, I think, as I said, we can't do everything, and we can't advocate or lobby, so we can facilitate with our families who, again, feel some isolation and feel where are the answers as they go forward, as these children grow up. So to have the partnership as our own partner is a wonderful asset that we have, and we look forward to working with them and bringing some of our older kids who can tell the stories of what they went through. The focus groups are wonderful. So again, it's a valued partnership, and we're very proud to be working with them. A message that goes beyond the event today is for people not to forget. And I think that's the sense that we get most from our parents, is that from family and friends who care deeply about what's going on, but are also dealing with the challenges in their own lives. So I think if the healthcare workers, we don't want to forget them and what they go through, but especially the families. So they might leave the hospital and it looks like everything is okay, but our message to our Wish family is never forget.